an AI paid version is not an alternative healthcare resource. You shouldn't be asking AI for medical advice. From my experience, and obviously very recently lived experience, it shows up with the patient convinced that the paid version of the AI they're using is correct. So they have put in their symptoms or their concerns into AI, and then the output that's generated automatically equates go to A&E or other advice, which really worries me. And again, there's two sides to this. I'm actually more worried about the ones that don't come to A&E, because I wonder, are those people the ones that actually need to be there versus the ones that are told to come to A&E that didn't necessarily need to be there, and they've been given false reassurances, false advice, incorrect advice. And the AI has completely ignored the inaccuracies, the harms, the bias, the population. And also there are alternative care pathways available. I fully appreciate currently where I'm working in the UK, GP appointments really difficult to get. So I understand that patients are turning to alternative forms of healthcare resources, but the way things stand, an AI paid version is not an alternative healthcare resource. If anything, it's supposed to be, I would actually almost want to say, I want to ban it from patients using it for that reason. You shouldn't be asking AI for medical advice. That's where my pet peeve lies. However, when patients come in to say, the paid version of this AI has told me to come in, I see that as an education moment, and it's a moment for me to explain to them why that the output is wrong. And if it's right, which so far it has not happened once, then I explain to them. And then that's, a moment of education. And then I'm hoping that will get carried forward. But that said, in high stakes situations, when I've got an AI fracture detection tool, it's great. It'll pick up a fracture that I may potentially have missed, but I still need to use my brain and my clinical judgment and decide if I'm going to trust the AI or I'm going to override it, vice versa, if I think there's a fracture and there isn't one. And it needs to clinically make sense. So if the pieces add together, it equals a fracture, then yes, the AI was correct. But there are times where it's not. But that's rapidly evolving, and that's the future. And I would love something like that to be incorporated, on a daily basis. All of those things are currently being trialed, just like with lung nodules on a chest x-ray or detecting strokes with AI. The anatomy needs to make sense. You see a patient, you've gone to medical school, you've got 2, 3, 4 degrees, you know what equals a stroke. AI is to be your second brain. It's your copilot. It's not exactly an automated answer, which is what I'm seeing. So I worry about the med students of today because they've jumped to AI, and I worry that they're not using their brain as their first brain, and they're using AI as their first brain. So for me to trust the tool, it needs to have gone through clinical governance and been approved. I need to see that, and I need to see how it's been approved. I want to know who the stakeholders were, who was involved in the making. I want to know that I'm still the human in the loop, and it's still my judgment that will make the final call. And like I said, it's my co-pilot, not an autopilot. And I want to see the statistics. I want literature to say it has worked and in what data set and what population group it has worked in. And I want to know about the biases. I want to know about the harms, the inaccuracies. So I want to know about the scientific facts linked with it. And I think like I said earlier, if it adds more layers to my brain or more layers or more tasks to my already multitasked day, I'm not interested in using it. It needs to make my life easier, and it needs to be an adjunct. And it's a classic, we keep hearing this, garbage in, garbage out. So it's that whenever I teach about it, I say it's the 3 Ps. So it's P being the patients, because obviously in healthcare, everything's about patients. The second P is people, which is being us, the clinicians, the healthcare providers. And the third P is profit. And I don't necessarily mean profit from the AI app. I just mean in terms of how much it's costing or what the funding is needed to continue using it if it's really good, and where we're going to get funding from. And this is purely from a UK government perspective that I'm speaking from.
Yeah, I think, though, that when you talk about the profit side of it, I don't think it really matters too much where you are. I think the difficulties that come from the bias that people aren't thinking about, I think, is where, for me, it's a little dicey. So what does AI not know? Well, it doesn't know anything unless you tell it, first of all, but it also doesn't necessarily understand the context. It doesn't understand history versus like real world today.
So you as a patient, and I don't mean you per se, but a patient using it doesn't necessarily know what pertinent positives and negatives to put into the AI. And even so, I wouldn't trust it because it's just based on a whole lot of information that I'm not sure I trust the medical literature associated with it, or if there's enough medical literature associated. certain ages, certain races, certain
Right.
population groups are excluded from it. And I don't believe that a patient is going to say, I am of Indian origin, my family history is this. These are exactly my medications. This is the symptom I'm having. And even if
Right.
this is the symptom I'm having, there are at least 5 or 6 other differential diagnoses that could be causing that symptom. You could go from mild, moderate to severe. And AI isn't going to pick up that
Right.
it's mild, moderate, or severe.